Good morning to all those who make this broadcast possible, to Gisela, to our sign language interpreter, and good morning to everyone tuned in to this briefing. Today, 5,049 people are hospitalized in Cuba. 3,843 are under observation. There are 786 suspected cases and 420 confirmed active cases. Yesterday, we processed 7,208 samples in our various molecular biology laboratories. These include facilities in Santiago de Cuba, Ciego de Ávila, Villa Clara, and Havana, with an important number of laboratories. Of the 7,208 samples processed, 26 tested positive for COVID-19. That's 26 people with the virus. This brings the total number of samples processed in the entire country since the pandemic began to 677,952, of which 5,943, or 0.88% of people, have tested positive for the virus. As I always mention, samples from all of the country's territories were tested. From Pinar del Rio, 157, the most from Havana with 4,079, Mayabeque 160, Villa Clara 348, Sancti Spiritus 1015, Ciego de Ávila 820, Holguín 141, Santiago de Cuba 90, and so on and so forth from all of the country's territories. Of the 26 positive cases diagnosed yesterday, 24 are Cubans and 2 are foreigners. One of the foreigners contracted the virus here in Cuba and is therefore a case of local transmission, while the other contracted COVID-19 abroad and is therefore an imported case. 17 or 65.4% of the 26 positive cases yesterday are confirmed case contacts. It was not possible to determine the source of infection in 8 cases diagnosed yesterday. This means that the source of infection in 43 cases reported over the last 15 days is still being investigated. Of the 26 diagnosed cases yesterday, 11 are male, for 51.2% of all cases, and 15 are female, representing 48.8% of all diagnosed cases in Cuba. 17 of the 26 cases yesterday were asymptomatic at the time of testing. Overall, 61% of all positive cases on the island since the pandemic began have shown no symptoms at the time of testing, and this figure rises to 69.2% of cases diagnosed over the last 15 days. By age group, 6 positive cases diagnosed yesterday are under the age of 20, all of which are in fact under 18 years of age, for a total of 664 children, or pediatric cases, to have tested positive for the virus in Cuba. Of these, 611, or 92%, have recovered from the virus and been discharged from hospital. Meanwhile, 6 people to have tested positive for COVID-19 yesterday are between 20 and 39 years of age. 10 cases are between 40 and 59, and 6 are over the age of 60. Of the 26 cases diagnosed yesterday, 20 belong to Havana, including the imported case, 4 to Sancti Spiritus, and 2 to Pinar del Rio. The 2 cases from Pinar del Rio belong to the municipalities of Guane with 1 case and Consolación del Sur, also with 1 case. The 20 cases diagnosed in Havana are from the municipalities of Centro Habana with 4, Cotorro 3, Arroyo Naranjo 2, San Miguel 2, Boyeros 2, Cerro 1, Habana del Este 1, Habana Vieja 1, and 2 cases from Playa, 1 of which is imported. The 4 cases from Sancti Spiritus belong to the municipalities of Sancti Spiritus with 3 and Trinidad with 1 case. Given yesterday's results by province, Ciego de Ávila continues to have the highest confirmed case rate per 100,000 inhabitants over the last 15 days, with 52.17. Sancti Spiritus follows with 31.34, then Havana with 10.58, Mayabeque 2.08, Matanzas has a rate of 1.53, Artemisa 0.58, Pinar del Rio 0.51, and Villa Clara with a rate of 0.26. No new cases of the virus have been reported in Camagüey, Holguín, Cienfuegos, Las Tunas, Granma, Santiago de Cuba, Guantánamo, and the Isle of Youth Special Municipality for the last 15 days or more. Cuba's rate therefore stands at 5.60 per 100,000 inhabitants over the last 15 days. To summarize, of the 5,943 people who have been diagnosed with the virus thus far in Cuba, 420, or 7.1%, are active hospitalized cases. Of these, 418, or 99.5%, are clinically stable. Yesterday, no one died as a result of the virus, meaning that the COVID-19 death toll on the island remains at 123, with a mortality rate of 2.06%, lower than the global rate of 2.91% and the regional rate of 3.31%. As I always mention, 2 people were evacuated at the start of the pandemic. Yesterday, 27 people were discharged from hospital, a positive result when compared with the number of confirmed cases yesterday. 17 people were discharged from hospital in Havana, 2 in Matanzas, and 8 in Ciego de Ávila. This means that to date, 5,398 people, or 90.9% of all confirmed cases in Cuba, have recovered from the virus. Today, 1 patient continues to be in a critical state and another reported as serious in hospital in Villa Clara. This is the situation in Cuba. Now we are going to turn our attention to the world. As of yesterday, COVID-19 continues to be present in the same 185 countries. Yesterday, 346,495 people were diagnosed with the virus, for a total of 36,194,764 confirmed cases since the start of the pandemic. Yesterday, 5,780 people died of the virus worldwide, for a total of 1,053,961 COVID-19 fatalities and a mortality rate of 2.91%. The region of the Americas, which accounts for 48.54% of all cases worldwide, reported 121,980 new cases yesterday, for a total of 17,567,673 people to have been diagnosed with the virus. Meanwhile, 2,893 people died of COVID-19 in the region yesterday, for a death toll in the Americas of 580,972, and a mortality rate of 3.31%. The United States continues to top the list of countries worst affected by the pandemic, with 7,549,794 confirmed cases and 211,801 COVID-19 fatalities. Then comes India with more than 6,835,656 cases and 105,526 deaths. Brazil follows with over 5,694,000 cases and 148,228 fatalities. In fourth place comes Russia, with 1,248,619 confirmed cases and 21,865 deaths. From the Americas, after the United States and Brazil, comes Colombia, Argentina, Peru, Mexico, Chile, Canada, Ecuador, Bolivia, Panama, the Dominican Republic, Guatemala, Costa Rica, and Honduras. These are the countries with the highest number of cases in the region. Meanwhile, Cuba occupies 21st place on this list. This is the information we have on the behavior of the pandemic in Cuba and the world.